because we're at the open air and we have enough distance between us, I think we can take our mask off. So Rafi, I wanted to ask you, I've heard of, and I think everybody, of rehabilitation in many fields of medicine, but how was the idea to create rehabilitation for sexuality was born?
The clinic was born because we work here in Reut Rehabilitation Hospital with people with disabilities. We work with spinal cords, we work with traumatic brain injuries, and these people, they have special needs inside the sexual therapy. People were discharged, we had to give them the long follow-up in their sexual matters, in couple matters, in physical matters. And this is how the clinic was established many years ago.
We're in a very challenging time.
Tell me about it.
It's Corona time. How do you see the clinic during this time? I mean, how many people are seeking for sexual therapy?
Actually, in the clinic we see a huge rise in the amount of people that are coming to the clinic, both disabled and non-disabled. The clinic was established during 2000 and the numbers were quite small. Today we see about 4,000 encounters a year, and actually we have the same infrastructure as we had in 2000, but the numbers are much, much higher. It is the largest public clinic of its type in Israel. And tell me you, Shelly, what do you see about libido in the corona? It's crazy what I see, but I want to see if your opinion is the same, because you are also part of the staff.
My personal experience is it's been very difficult. I see it as couple with kids and couple without kids.
You have 2 little kids.
I have 2 little daughters, and again, it's a great time to feel connected to them, but it's really hard to find time for my partner. And I see that among a lot of clients who I work with who has kids. This is what we work with people, how to divide your time, how to leave room for intimacy, find time for hugging, for kissing a little bit.
You should explain them what is sex. Yes. We deal with the meaning of sex. What is sex? And actually most of the patients, they don't know the answer. I would define any intimate closeness.
I not only agree, I think once we think about your definition of sex, it is much easier in our mind and even to find the energy to actually have intimate time. So I think you actually found a solution especially for Corona time.